Hi, my name's Stephanie Arnold. I'm a consultant dermatologist in Oxford, and I'd like to talk to you today about lichen sclerosus and hopefully answer some of the questions you may have. First of all, what is lichen sclerosus? Lichen sclerosus is an inflammatory condition of the skin. It can affect anywhere on the body, although it's much more commonly found in the genital area. It can affect men as well as women. And in women, we tend to see it most commonly in two age groups. First of all, in young girls before they hit puberty, and also in women usually after the menopause. Having said that, it can affect anyone at any age. Well, first of all, we don't really know what causes lichen sclerosus in the first place. We think it's an autoimmune condition, which is where for some reason your body's immune system attacks itself and causes problems on the skin. We think that lichen sclerosus is an autoimmune condition because it's associated with several other autoimmune conditions. And so many women with lichen sclerosus in the vulva may also have other health problems such as thyroid disease, pernicious anemia, or diabetes. And it's important to get these checked out if you are diagnosed with lichen sclerosus. We do know that lichen sclerosus tends to get worse in areas of skin that are under friction or that have been injured. That's something called the Koebner phenomenon. And so for many patients with this condition, I recommend using very gentle skin products such as a bland moisturizer, both to wash with and as a moisturizer, and also trying to avoid sanitary towels, tight clothing, and other potential factors that could irritate the skin, because that can make your lichen sclerosus worse. In a nutshell, yes, we do see patients who have both lichen planus and lichen sclerosus. Most commonly what we see is patients who have lichen planus in the mouth, and this is something that can be symptomatic, but also is sometimes just something that has been commented on by the patient's dentist. And then they also have lichen sclerosus in the genital area. Now, both of these conditions are not that rare, and so it may be that a patient just happens to have both of those things. Occasionally, we do see women who have both lichen planus and lichen sclerosus in the genital area, and this can be very difficult to manage because lichen sclerosus affects the outer parts of the vulva, whereas lichen planus can also affect the inner parts, including inside the vagina. This can be a very severe and debilitating condition. Lichen sclerosus tends to be very characteristic, and so for doctors who have experience in dermatology, and particularly people like myself who run genital dermatology clinics, it's a very easy diagnosis to make. Let me take you through how I make the diagnosis. So first of all, most women with lichen sclerosus will have symptoms of itch or soreness, or they may have symptoms such as pain with sexual intercourse. Having said that, not all women with this condition are symptomatic, and some women are sent to see me because they've had a smear test or a genital examination for another reason, and the nurse or doctor looking after them has noticed changes in their skin. Other things that patients may notice include changes to your skin in the genital area, and this is how we most often make the diagnosis in the clinic. Lichen sclerosus is very characteristic on the skin. Usually what we see is porcelain white skin changes, and usually these affect the outer parts of the labia majora as well as the inner parts of the labia majora and the labia minora. This may affect the groin and also the area between the vulva and the anus called the perineum. It also, not uncommonly, affects skin around the anus. The other thing that patients may notice is that their anatomy may change, and this can happen relatively slowly over a number of years. Unfortunately, with lichen sclerosus, sometimes this condition causes scarring to occur on particularly the inner aspects of the vulva. So the small lips, the labia minora, can become reduced in size or may start to stick to the outer labia majora. Other women may notice that the small flap of skin that normally exists over the clitoris starts to become tighter and smaller, and so doesn't move in the same way that they may have experienced before. Now, some women with lichen sclerosus, for a small minority of women with lichen sclerosus, the diagnosis is not that easy to make just on clinical grounds. And so in that case, I will take a small biopsy. This sounds worse than it is. What we do is inject a small amount of local anaesthetic under the skin. This stings when it is injected, but then the area will go nice and numb. We take a tiny sample of skin, just 4 millimeters across, and put a small stitch in just to stop any bleeding. That sample of skin is sent to a laboratory and analysed, and hopefully then we can make a diagnosis for that small group of women in whom the diagnosis is not clear based on just an examination. I think many women, many adult women, have symptoms of itch or soreness in the vulval area from time to time, and all of us probably just assume that it's an episode of thrush. And I think if you have a discharge that's characteristic of thrush and it responds to either a thrush cream, pessary or tablet, then you don't need to see a doctor. However, I think if the itch or soreness persists, and particularly if you have been through your menopause, then I think it would be well worth seeing your doctor to get a proper examination and have someone look at things down below. The reason I say this is that thrush is very common in women after puberty and before the menopause, but it's very uncommon in girls and it's very uncommon in women after the menopause, unless you have another health problem such as diabetes. And so don't just assume that the symptoms you're experiencing are due to thrush. Have a look yourself, and there are very useful resources on the internet about how to examine your vulva and what is normal and what is not. And if you're still not sure, I really would recommend seeing a doctor. It's much better to get this condition diagnosed early, not only to help relieve your symptoms, but also to help perhaps prevent some of the long-term consequences of this condition. I hope I've been able to answer some of your questions today and put your mind at rest.